Today and continuing next Monday, the committee will be conducting oversight hearings to review the several state regulatory boards and the Department of Consumer Affairs. These hearings are part of the committee's ongoing responsibility to exercise oversight of state agencies under its jurisdiction. The primary purpose of this review is to assess the effectiveness and efficiency of these agencies in protecting the consumers and to determine whether changes in the law or in their operations or functions are necessary. Today we will be reviewing specific issues regarding the Department of Consumer Affairs, the Acupuncture Board, the Board of Podiatric Medicine, and the Court Reporters Board. To assist members in their review and evaluation of each agency, committee staff has prepared a background paper which identifies issues and makes staff recommendations for each agency. The paper has been posted on the committee's website and made available to all interested parties. Anybody have a chance to look at it in advance? Okay, everyone's nodding. That's good. You did too? Oh, that's really encouraging. Committee staff has also asked each agency to focus its comments on the more critical issues that have been raised. We will ask each agency to begin their testimony by providing members with a brief overview of their programs and respond to the more important issues raised by staff. Members will also have an opportunity to raise any other issues or questions which they may have. We also have the opportunity to hear from consumer groups, professional organizations, and members of the public. As I begin, I'd like to recognize my co-chair, Bill Emerson. Mr. Emerson, do you care to make any comments before we begin? Okay. Okay. Well, let's begin with the Department of Consumer Affairs by introducing the Director, Denise Brown, and the Chief Deputy Director, newly appointed Chief Deputy Director. Surprise. Madam Director, you may begin.
Chairman Price and members of the committee, my name is Denise Brown. I'm the Director of the Department of Consumer Affairs. I'm joined today by Awit Kadani, the Chief Deputy Director for the department, and Brandon Rutschman, who is the BREEZE Project Manager. First, I want to say thank you for allowing us the opportunity to update the committee on the department's progress on several important topics. I also want to thank the committee staff for all their hard work in putting this hearing together. They have been very helpful and absolutely wonderful to work with. I was just recently appointed as the director, but I have more than 30 years' experience working at the department in a variety of roles. One of the things that has kept me with the department for so long, besides the great staff, is my belief in the department's mission, which is to protect and promote the interests of California consumers. The department consists of 36 boards, bureaus, committees, commissions, and programs that license more than 2.5 million individuals and businesses in over 200 professional categories, including doctors, nurses, contractors, private security companies, and private post-secondary institutions. The department's programs impact Californians on an almost daily basis. With the chairman's permission, I would like to take some of the agenda items out of order and begin with an update on the department's outreach efforts, specifically with relation to webcasting of board and committee meetings. In an effort to increase transparency throughout the department, webcasting is made available for any of the department's constituent agencies. Currently, the department has 3 videographers, which can present up to 4 simultaneous webcasts at any given time. Many boards routinely make use of the service. In fact, just within the last 2 months, the department has already webcast 15 meetings. Additionally, the department continues to work with the boards and committees to implement 2 important regulatory packages. The first is regulations regarding the uniform standards for substance abusing licensees in the healing arts boards. The standards were developed by the Substance Abuse Coordinating Committee, which was established by SB 1441. The standards create consistent minimum standards for use in dealing with substance-abusing licensees in 16 specific areas, regardless of whether or not a board has a formal diversion program. The Department believes these standards are crucial for consumer protection and is committed to their implementation. Currently, a number of the Department's boards and committees are in the process of implementing these standards through the formal rulemaking process. The Department expects several will complete the rulemaking process in the coming months. In addition to the uniform standards, the Healing Arts Boards are also in the process of implementing regulations related to Assembly Bill 2699. This bill allows out-of-state licensees to participate at sponsored free healthcare events. To aid the board's efforts in promulgating regulations to implement this bill, the Department provided suggested regulatory language. Already, a number of the boards have begun the formal rulemaking process. Much like the uniform standards, the Department expects that several boards will complete the rulemaking process in the coming months. At the request of your staff, we have provided them with a document showing each board's progress in implementing these regulations. At this time, I will turn to Awet, who is the executive sponsor of the BREEZE project, and who will provide an update.
Thank you, Director Brown. Chairman Price, Vice Chairman Emerson, thank you for the opportunity to present. My name is Awet Kidani, Chief Deputy Director of the Department of Consumer Affairs, and as the Director said, I am the executive sponsor of the BREEZE project. BREEZE is an enterprise-wide IT project effort for the Department that, when completed, will provide a comprehensive IT system that will connect licensing and enforcement activity among all Department entities. It will provide the Department boards, bureaus, and committees with a solution for applicant tracking, licensing, renewal, enforcement, monitoring, cashiering, and data management capabilities. Additionally, BREEZE will be web-enabled, allowing licensees to complete applications, renewals, and process payments online. Consumers will be able to file complaints, access complaint status, and check licensee information online as well. Essentially, Senators, we're bringing the Department and its constituent entities to the 21st century and making it a much more transparent process. The vendor, Accenture, has begun work and will be implementing the BREEZE system in 3 releases, the first of which is expected to be completed by September of this year. The first release will implement the BREEZE system for 10 of the Department's boards and committees, including the Medical Board, the Board of Registered Nursing, and the Board of Barbering and Cosmetology, which are among the Department's largest boards. We expect the BREEZE system to be fully implemented throughout the Department by the end of 2013, which is very good news for such a very large project.
That's a very long time.
Absolutely, and under this leadership and a watchful eye from our control agencies and this director, we feel very comfortable about the current timeline. And we'll work very closely with your staff, Mr. Chairman and Mr. Vice Chairman. The costs for the BREEZE system are distributed and paid for amongst boards, bureaus, and committees based on their respective size out of existing, and that's a very important thing, existing licensing fees. Boards and bureaus with larger licensing populations will pay a greater share of the costs. Conversely, smaller boards will have a much smaller share. It is important to note the boards, bureaus, and committees will only begin paying for BREEZE once they are integrated into the system, and the cost for the system will be paid for within existing funds. Essentially what that means, Senators, is if we don't get the product and we don't like it, we don't pay. And that's a very, very important distinction, given the complexity and the number of customers that are going to be subscribing to the service. We have a lot of boards, bureaus, and it's a very, very complex issue. So if any of our customers are not happy, Brandon has been wise enough to instill different gates within that system where if it's a no-go, it's a no-go, and we go back to the table. And it's in the state's best interest. Additionally, consumers will not be asked to pay any kind of additional processing fee or convenience fee for the use of credit cards through the board's website to pay license or renewal fees. Credit card fees, again, will be absorbed by the boards, bureaus, and committees through existing funds. The BREEZE system represents one of the most significant undertakings of the department in the last 20 years. It will significantly improve the operations of the boards, bureaus, committees, and improve the type of service we can provide to California consumers, which is why we are so excited about making BREEZE a reality. And at this time, if it pleases the committee, I would like to turn it over to my colleague, the project manager, Mr. Brandon Rutschman.
Thank you, Mr. Chairman and Senators of the committee. As Owette said, my name is Brandon Rutschman. I'm the BREEZE project manager for the Department of Consumer Affairs. As you may know, the project's feasibility study report was approved back in November 2009. Since that time, we've concluded our procurement activities in September of 2011 with a contract award to Accenture, who will design, configure, and implement the BREEZE solution using Iron Data's Versa software suite. Since the contract award in September 2011, we've completed refining the project schedule. In the proposal, they had an aggressive schedule. We need to balance that with the state's ability to support that within the approved resources. Due to this refinement process, the anticipated go-live date in the SPR was July of 2012. We've moved that to September 2012 to make sure that we could support that effort. In addition to the schedule refinement work, various planning and analysis activities are underway. The primary of which is converting 20-plus years of legacy system data and multiple outdated systems into the new BREEZE data model. So we started right away on that. Also, starting the detailed design sessions, which elicit the detailed business requirement from each board and bureau to make sure that their business is supported in the system. We're focusing right now on Release 1. However, we're bringing in the later releases to promote buy-in and early engagement in the project. Project budget to date, we've spent $4.8 million of the $45.7 that was approved for the project. The planned budget...
I'm sorry, you say 45.7 was authorized, and how much...
That's correct.
How much expended to date?
Expended to date is $4.8 million. So our planned budget to date is about $5.4 million. So we should have spent $5.4 million, was approved by this time. So only spending 4.8, we're about $600,000 under budget right now. So regardless of our achievements to date, it's no secret, and the DCA is well aware that state IT projects are troublesome more often than not. So the DCA is being hyper-vigilant in identifying and mitigating project risks as they occur. Some of our key focal points in this area is data conversion. We have, as I said, 20 years of legacy data. We need to get into the new system. Licensees can't lose their licenses. We need to make sure it gets over there correctly. So we're working with the solution vendor, watching the progression of those activities in concert with the technology agency to identify any resolution that we may need. Also, we're making sure that as the system is presented to the boards and bureaus, we have a huge organizational change effort. We want to make sure that the system is adequately configured so that it doesn't force them to lose confidence in the system and then tune out of the project, which would lead to failure. We have an aggressive outreach campaign. Part of that is the brochures that we distributed earlier. But to set expectations with our stakeholders, both boards and bureaus and licensees, to let them know what is coming. That's all I have. Back to Director.
As you can see, the department is making... Thank you. As you can see, the department is making great strides to improve consumer protection, transparency, and efficiency. I'd like to thank you again for having us here to present this morning, and we're happy to answer any questions you may have.
Well, thank you, Director Brown, for the comments and testimony of you and your colleagues. The opening conversation about the webcasting and public participation was interesting, and it appears that the department has been very aggressive in at least making the technology available. But is it still sort of a voluntary effort? I thought we were really trying to require and impose the technology to be implemented as quickly as possible. It sounds like you make it sound like it's sort of optional, and if they want to do it, they can. And we're happy to accommodate them if they come to us.
Thank you for asking that question. In the current structure of the department, the department offers the boards any kind of support that it can in administrative and other ways. We can't mandate that boards use it, and we are only now at the point where we actually have the capability to do multiple webcasting. So to the extent that the boards want it, we can provide it, and the more that the boards see how it works, the more they are asking for the service.
And no one's turned it down after they've used
Correct.
it. They haven't said, we don't want to do that anymore.
Correct.
What's the discussion now about the feasibility of some kind of a call-in system that could be used by boards for their meetings to, again, encourage greater public participation?
We've started discussions in that area. From a technology standpoint and just a logistical standpoint, it appears that it's bigger than it might sound. Some boards, because you have to have a remote location where people can actually physically go. And so that's something we're exploring, but we have not really addressed it to its fullest.
We're just
yet.
focusing currently on the
webcasting.
and video technology.
Yes.
We've been joined by Senator Gloria Negrete-McLeod. Welcome. Any questions from the Vice Chair?
What's the target date to have all the bureaus and boards implemented in the BREEZE program?
So the target date for the Release 3, we're currently targeting October of 2013. That's correct. All the boards and bureaus will be on at that time.
So the first phase is the 5 boards that you mentioned, I think.
It's those are the 5 largest, Mr. Vice Chair. There are 10 in that phase.
I see.
Right. The 5 largest are the, lack of a better term, the big ticket item or the big ticket boards that we're going to learn the most from.
And so the whole program will be implemented by 2013. Okay, thanks.
Senator McLeod?
Is this IT system part of the bigger system that we're looking in sub 4, the greater IT system that they're going to put in? Or is this something separate altogether? And excuse me because I came in late.
Senator, without knowing the context of what sub 4 is looking at,
We're looking at Fiscal. Is Fiscal part of this?
It is not part of this. It is the same vendor. However, the Accenture. Rest assured that we're the DCA as well as our partners in our control agencies are looking at the resources associated with that to make sure that the DCA and other agencies, are provided for. The Fiscal and the DCA projects require 2 different skill sets. At risk of getting too granular, they require 2 different skill sets. Fiscal requires one skill set that is not, licensure and enforcement. Fiscal requires a different one, and we're on 2 different tracks in terms of the project. They're going to be getting into development, and we're rolling out the first phase. So we feel right now, we feel comfortable about where we are and as it relates to resources. I'll turn it over to Brandon for anything I missed.
You said it well. The Fiscal project is a financial ERP product, different resources, skill sets, as Owette said, and the BREEZE is in licensing and enforcement regulatory solutions. So again, we don't feel there's any conflicts. However, having said that, we're watching it. We've let Accenture know that we're concerned. We're working with tech agency, again, to make sure that those conflicts don't arise.
Well, but the problem is that we as a government are trying to wrap our arms around a whole system that works for the entire system of California government, and yet here we have one system doing this and one system doing this, and I'm sure there's systems doing this. So we're still not doing what I would venture to say is good government, where everybody's kind of under the same umbrella, even though you're all doing different things.
Senator, if I may, the one thing from a project perspective that we have to consider is the technologies that are built to support different business functions. So we have the problem with IT projects is trying to make it a Swiss Army knife, which leads a lot of complexity, a lot of customization. The way that we can best leverage these products is to take quality products that have been developed and implemented in specific business sectors and then use those in California. Having to integrate those into one complete solution may be more problematic and risky.
You were at the other hearing.
Yes.
Okay.
Chair Mahdi, California Technology Agency. Breeze deals with licensing and complaints.
No, I get that everything deals with different things, but what I'm talking about, as a state government, there should be like a mother plan over the children plan, over the grandchildren plan, rather than having everybody has their own plan, and then when they all go kaput, then they all go kaput at a different time.
At this point, like Brandon has said, different solutions deal with different issues. Fiscal is a financial system. It deals with accounting. It's an ERP. And here is licensing. Combining both, we don't have a system that is going to be talking about licensing and be talking about financials as well. We are looking at fiscal from enterprise view to replace silo systems that are out there, that are financials and accounting, assets accounting. So those are the areas that we are looking at, to look at similar functions and try to group them under one project.
Okay, because all boards have their own fiscal and their own fee schedules and their own things, so they should also be part of fiscal, so that when people pay fees, you have some way to track them. Okay.
Well, we agree that there needs to be more coordination. I guess that ultimately is what Breeze will do. But it does underscore, the Senator's comments does underscore the fact that we, still sometimes aren't talking to each other, right? And that's the whole idea of...
Yes. And the accounting part of this year will go through fiscal.
Okay.
But the licensing is a separate...
Yeah. No, I get that. I understand that.
Okay. Any other questions on that topic? There was you made a reference, passing reference to the uniform standards issue with Maximus, and I wonder, has that contract been amended to begin implementation of the requirements of SB 1441 as it relates to enrolling in the diversion program? What's the status of the Maximus contract?
Mr. Chairman, Mr. Vice Chairman, our legal department is looking at that issue right now. We're looking at it in a much larger context, and we're working with your committee on that larger context. The Maximus contract was audited.
It was audited, I believe, in 2009 or 2010, with another secondary audit that took place sometime a year or so ago.
And thank you, Director. And we're using those findings to find the best policy to move forward with regard to Maximus. As we're looking at that, we're working with the committee on the larger issue, which is the 1441 implementation. I hope that answers your question.
Well, I guess there's no answer yet. Something we do want to get resolved, and I think coming up with an implementation date as soon as we can helps us to kind of focus on moving us forward. Something we all are concerned about. Any other questions, members? Any comments? Questions? Done? Okay. Well, I want to thank you for your presentation. You've done a lot of work. There's still a lot of work to do. The importance of this agency can't be stressed enough, as you know, and the confidence that we must make sure it has, not just with professionals, but also with consumers, is very important. And so, again, thank you for your efforts, for your bringing some organization and some urgency to the issues, and look forward to working with you as we move forward.
Thank you.
Thank you, Mr. Chairman, Mr. Vice Chairman. Thank you.
Thank you. Okay, we're going to move right along with review of the Acupuncture Board. We have Board Chair Lee, Executive Director Wedge, and the floor is yours.
As you just mentioned, and the licensed acupuncturist is regulated as primary care provider, and because of the increasing demand from the consumer. So our standard and request for the profession has to change according to the consumer demand. And there is some misconception. The board keep increasing the hour in education, try to become a physician. That's not wrong. No matter how many hours we increase, we are still licensed acupuncturists. We cannot prescribe drug. We still use the needle and the herb and some Chinese medicine modality to take care of the patient. I will brief in 4 areas, then I will refer the CO in more detail. The board visits every approved school. The only problem is the out-of-state school will to get approval for travel from the governor's office. And in the past, we just get one approval for out-of-state site visit. And we believe since the budget is through the license fee and the penalty and continuing education, through the future budgetary adjustment, we hope we can do more for the out-of-state site visit. For the continuing education, the board just recently discussed to assess the class approval fee. We do not charge that. This will allow the board to hire the specialists to supervise the continuing education. The only problem we hear from the continuing education is regarding the non-Chinese medicine, non-medical subject. And we allow the licensed acupuncturists to learn up to 5 hours in 2 years. And the board may change to, there's no requirement, but they do that, it's only up to 5 hours. The reason for that in the past is because we believe some not approved or evidence-approved subjects, it may be proved in the future. So since it's the beauty of this country, there's liberty in knowledge and allow the acupuncture up to 5 hours in 2 years to learn what they are interested to do. For the license exam, we do not have major problems since we contract the exam to the private company. And the company also take the exam for other profession without major problem. Our last instance is the Korean language. The Korean language issue, in fact, is not a problem. What happened is the examinee, beyond their expectation, they find some Korean language in Chinese. And as we know, it is common for even in law and medicine. For some language is not related to the original meaning. It is very difficult to translate into English. So some Latin language will appear. In the examiner's handbook, we give them the example. That is the format of the exam. But we not hear any complaint or input from the student. For exam company, just put some Chinese language in order to show the original meaning. And that may be beyond the student's expectation. So the board, it's the board's courtesy to allow the student to retake the exam without fee. But it is not something wrong from the exam company. So after the second exam, we don't hear any complaint from the examinee. So this is my brief introduction, and I will have executive officer to go into more detail.
In follow-up to Chair Lee's report, in 2006, the board was reconstituted, creating a new board of 7 members, 4 public and 3 licensed members. The quorum requirement was changed from a majority of the members to 5. This did affect the ability of the board to conduct business. In 2009, legislation changed the quorum requirement to 4 members, which required that at least one be an acupuncturist. Currently, the board has 2 licensed positions vacant, and therefore it is critical for these vacancies to be filled so it does not affect our ability to conduct business. The board has a total budget of $2.5 million. The board has always had a healthy reserve. However, with a recent loan to the general fund and the required move of the board, in which our rent almost doubled, it is projected that we could possibly be in a deficit by 2014. So careful monitoring of our budget will take place.
The forced move, why? The lease is up, or why are you
The
moving?
lease was up in our where we were located in 2011, and the landlord was not able to bring it up to ADA be compliant. So the department moved us to their new headquarters, which was significantly more than we were paying. The board has been asked to respond to 4 issues identified in the background paper. One of these issues is board operations. It has been stated that the board struggles with decision-making and lacks follow-through. One of the examples given was that the board approved 6 different regulation changes, and none of these were mentioned in our sunset report, and no further action was taken on these regulations. Actually, the regulation changes regarding transfer credit, independent study, and clinical training were all proposed amendments that were decided at different meetings, yet basically affected the same section of the regulations. In an attempt to avoid confusion and multiple regulatory packages affecting the same section, each time a new change proposal was made, the regulatory process started over for that specific section. Now it has been discovered that we cannot make changes to that section anyway until such time as legislation is passed amending section Business and Professions Code Section 4939, giving us the authority to request those changes. Section 4939 states that on or before January 1, 2004, the board shall establish standards for the approval of schools. The above regulatory changes are all standards for the approval of schools, so therefore legislation needs to be pursued to remove that date. The regulatory package for disciplinary guidelines, which does include the uniform standards related to substance abuse, has been completed and is currently with legal. This package had been held up based on the issues surrounding the uniform standards, specifically conflicting legal opinions issued by Legislative Counsel and the Attorney General's office. But it is proceeding. At our August 2011 meeting, the board voted to begin the regulatory process to repeal the multilingual exam. Proposed language was brought back to the board at their November 2011 meeting. A vote on the proposed language did not occur, and the matter was referred to a newly formed English Language Exam Committee. I apologize, an error was made in not mentioning the above regulations in our sunset report. However, appropriate action has been taken on these proposals. Another example given for lax follow-through was regarding a blue ribbon panel, which was established to look into important issues regarding primary care definition, scope of practice, and related educational requirements. It is true that this blue ribbon panel has not met. However, the issues have been delegated to the Education Committee, which did meet in a public forum in February. The majority of all committee meetings have been held in a public setting. To my knowledge, the only time the committee meetings have not been held public is when members of the committee, which is comprised of less than 3 members, have met strictly for planning stages. The background paper indicates that in 2009, the board decided to make important changes to the law regarding school approvals, but ended up deferring to a National Acupuncture Association and hasn't moved forward with dealing with the problems surrounding school approval. I'm not sure what is meant by deferring to a National Acupuncture Association. The board did sponsor legislation requiring approval of schools by an accrediting body of acupuncture schools recognized by the U.S. Department of Education. However, the board was retaining its authority over the training program and its curriculum. This legislation was opposed and was subsequently amended to delete all reference to acupuncture. Another issue addressed is in regards to the board's compliance or adherence to its strategic plan. I'd have to say the majority of our objectives have been attempted or met. I'm happy to discuss each of these issues with you now or address it in a final written report. It was a fairly new board when the strategic planning session was held, with an outside contractor being the facilitator. I don't believe the facilitator guided them correctly, and it's my belief that when some of the goals were identified, the board was looking at them as wishes and not necessarily something attainable.
Wait. Wishes, but not
Wishes, like,
attainable?
we hope to do this. It's not that a guide or a direction to...
Make that happen.
We do have a strategic plan session scheduled for 2012 with the current board and will be facilitated by the department.
2012, this month, next month?
It's supposed to be in May. Right now, we're trying to find a facility. It has been decided that they want the meeting down south, so more individuals can attend our meeting, and we're just trying to find the facility to hold that. But it will be the first day of a 2-day meeting. The background paper also indicates that the board has problems with its scheduled meetings. I'm unaware of our meeting materials being insufficient to foster meaningful discussion or decision-making by the board. It is true that prior to posting our meeting materials on our website, they were not available until the day of the meeting. However, since we started posting them, they are usually available somewhere between 3 and 7 days in advance of our meeting. School oversight. The board had previously worked closely with the Bureau of Private Post-Secondary and Vocational Education on school site visits, as they had expertise on the overall school operations, and the board had expertise with the school's training program, its curriculum. When the Bureau was sunsetted, the board sponsored legislation to require approval by an accrediting body of acupuncture schools recognized by the U.S. Department of Education, but that legislation failed. Continuing education issues. The background paper questions whether the board has sufficient oversight of its continuing education program. The board believes that if we were fully staffed, there would be no issue with our ability to audit at least 25 licensees per month for CE compliance or more.
How many are you auditing currently?
10. On a biennial renewal cycle, an average of 400 licensees are renewed each month, and 25 of that number is approximately 6.2% of renewed licensees that we would be auditing, and it was hopefully we could expand that number. The background paper also discusses the number of CE course approvals that occur each month and that we do not charge for approving individual CE course requests. The board agrees this is a significant workload and has just started researching other boards that charge for individual course requests and the conditions surrounding that charge. The board hopes to pursue legislative authority to assess a fee for CE course approvals. And finally, on the licensing exam, the board is still of the belief that the California Acupuncture Licensing Exam should remain the state's licensing exam. The paper mentions the possible use of a national exam. I have been advised that it is a misnomer to state there is a national exam. There is no national standard and no uniform exam administration for acupuncture licensing. The National Commission for Certification of Acupuncturist exam is made up of 5 different modules to encompass the different states' requirements. The cost for this exam is approximately $1,300 as compared to the board's exam fee of $550. And I'm here to answer any questions that you may have or address something that I have.
Okay. All right. Members, any comment? You referenced the oversight of schools, and could you elaborate on what steps you're taking to ensure that there's a greater oversight from the board of the educational organizations' activities?
Well, in cooperation and in conjunction with the Bureau of Private Post-Secondary, hopefully we can do joint, we do need to enter into an agreement with them, as we had with the prior Bureau, to do on-site visits together. They have the ability to review the certain operations that really our authority is focused on the training program itself, the curriculum, the teachers, the transfer credit pre-qualifications. that would be our next step.
As you can tell from our background paper, we have some very serious concerns about the way this board operates. We've actually had Senate staff, observing the board meetings. We've looked through your agenda. We've seen how this board conducts its meetings, what issues it gets involved in, and what we find is that the board seems to be caught up on more the professional issues rather than the consumer issues. We would suggest that you review this background paper closely, respond back to us for each of the specific issues that we raise, and then we'll see what recommendations are forthcoming after that. But again, as I said, we have closely observed the board ourselves and do find some serious concerns about the way this board is currently functioning. And I just want to say that from a staff perspective.
Certainly, as electeds, we're concerned as well. It does impact the perception even of the public as of the services. Because of these efficiencies, the board is recommending, staff is recommending only a 2-year renewal. And so I would encourage you to respond more fully to questions that are raised. There's some very specific issues about operations, about governance, about process that I think we'd like to get some further clarification on and further assurances on, so that we can be assured that that we're moving forward in the public's interest. Again, we appreciate your efforts, your commitment, but we've got to make sure that the agency, the department, this particular board is running in a manner that gives everyone confidence that the right things are being done all the time. And we're sure you'd like to see that too, correct? Great. Okay, if there are no other questions, thank you.
Thank you
for your
this
presentation.
Opportunity.
Thank you. We look forward to your follow-up. Okay, ladies and gentlemen, we move now to the okay. Oh, I'm sorry. Okay. Yes, did you want to make a comment, sir?
Yeah, I didn't know if public comment at the end of the day or at the end of the
Well, we're going to wait, but we certainly can take public comment now. Why don't you come up? Identify yourself, give us your name, and
My name is Dr. Stephen Grenstead, and I was just notified about this hearing about 8 this morning, and I rescheduled my whole patient load to be here because I feel this is so important. My doctorate's in addictive disorders. I also have a master's in counseling psychology. I've been working with people with mental health and addiction problems for 29 years. I've been involved with physician healthcare diversion programs since 1988.
Which board are you commenting on, Doctor?
I'm a public member. I'm commenting as a public member. I'm a private practitioner who has worked with people in diversion since 1988. Most currently, last year, 2011, I've been working with several of the boards, including the Board of Registered Nursing and the Dental Board, and with Maximus as a whole, to improve their diversion outcomes. And as I looked through the information that was sent to me at 8 o'clock this morning, I'd like to highlight just a few brief points of concern.
Thank you. Please do.
Number one, in times of economic concern, a lot of what's being put out in this literature is going to be very costly. And some of the information is about the audits on Maximus, for example, that there's been 3 audits that they've passed. Now, did they pass 100%? No, nobody does. I've been involved in agencies, healthcare, hospital, mental health treatment programs when they get audited by their licensing committees. And there's never 100% compliance, but agencies are required to meet standards. Maximus has met the standards. And yet we keep going back to the same things. And I noticed in here there was horror stories that were coming out in newspapers, which are fear-generated and contain half-truths and misinformation. And that very much concerns me. My usual OCD self, I would have had a written report for you, but since I didn't have the time, I won't. I would be more than happy to give you a full report on everything I'm stating today.
We'd be happy to receive that in writing if you choose to submit.
I will do that in writing. One of the other things, that monitoring and testing is working currently. Everything is up to standards now. As of last year, Maximus has met the new standards for monitoring and testing. That it's not broke. So why spend a lot of costly money that the state cannot afford right now in going forward with this? And many of the comments were accurate 2 to 4 years ago, and that's no longer true. That's one of my big concerns right now. The other thing that happened in 2008 when the Physician Diversion Board was sunsetted, for the last 4 years, public safety has been jeopardized horribly because of this. Because now it takes many months to several years before these doctors are pulled out of their practices, and they are still seeing the public. And my concern with what's happening with this whole diversion piece is that's going to happen with other diversion boards. And I don't want to see that happen. And I will definitely write this up and get this to you.
Thank you for your comments.
Good morning. My name is Mary Hegarty. I am a registered nurse. I have been a registered nurse for 50 years. I have been involved with the Board of Nursing since 1997 with their diversion program, probation program. I do run a nurse support group, and I also sit on one of the diversion committees, which they refer to as DEX, Diversion Evaluation Committee, which is where the nurses are presented to be seen by the committee to determine their rehabilitation plan. I am not a legislative groupie. I don't follow the legislature, but I have found myself giving up pickleball games to come and sit and tell you about my concerns. And I have a grave concern also about this report, which I received last night, the report that's before us today, entitled Background Paper Regarding Issues to be Addressed by the Department of Consumer Affairs. And issue number 2 is about the diversion program and the implementation of Senate Bill 1441. I am a great believer that in order for our legislators to really do their jobs and represent their constituency, and certainly represent the public, the safety of the public, paramount issue, I believe you have to have unbiased and factual data. As I looked at this document, it contains so many sentences that are misleading, that are untruths, that are certainly not clear-cut evidence of what the diversion programs are about. I have concerns that in here we are referring to the document, not we, I didn't write this. I don't know who wrote it. That's the other thing. I really don't know who wrote the document. But anyway, I'm concerned that they refer to the LA...
the staff and the committee, and the committee, so you can...
Okay, the staff, okay. But to refer to the LA Times as sort of a, we need to be concerned about what they're saying, it concerns me a lot. That is not fact. That is the LA Times, okay? The other piece is that I've read so many times, and it's apples and oranges, I've read so many times about the closing of the medical board. As a Californian, I'm not real proud of that because California is only one of 3 states in the United States of America that does not have a diversion board for the physicians. And I totally agree with Steve that we need to monitor them. Closing the diversion program did not solve the problem. Addiction doesn't go away. Again, I looked at the audits. I was involved with my nurse support group and with Maximus sitting on a committee, a diversion committee. And I remember when the audits were going on at Maximus, and they went on for months. Months. They were like tenants living at Maximus. They were there for so long. What's interesting is I, as a former state employee, and one of my positions was evaluating and auditing programs, doing on-site reviews. What I see is that Maximus didn't meet some paper documentation. If every state agency that had deficiencies in paper, missing documentation, if they were cited for it and it was enforced, we'd all be closed. We would all be closed. I don't see it as a big deal. I think the biggest deal that happened at Maximus was not discovered in the audit, but in fact was discovered when the subcontractor urine tester was found to not be testing within the standards that had been applied to that contract. However, it wasn't put under the rug. All nurses that and other health professionals that were tested, they followed through on it, and there never was any direct harm to any patients as a result of that. They've changed the whole system, and it's working. The other thing is the uniform standards. Oh, boy, I've sat through many of the Department of Consumer Affairs talks on the uniform standards, and I guess my greatest concern about the whole thing is that we, as the healthcare industry, acknowledge that addiction and including alcoholism is a disease. And yet, as I look at the standards, there's so much more penalizing of our healthcare professionals because of this addiction. What's going to happen is we will have no more self-referrals into the program, which means more and more addicts and alcoholics will go underground. And that's very frightening because it means they could practice longer before they are monitored. We do monitor them in the diversion program. I have worked with 3 different contractors, and Maximus seems to be the one that is most able to correct the minor deficiencies, that is monitoring all of the healthcare professionals, okay? The standards, again, I read one of the statements in here about that because the boards had challenged some of the language in the standards, that this committee decided to formulate this document entitled the Legislative Council Opinion. I don't see that, so I don't know what it says, and I don't know who wrote it, but the recommendation of the staff is kind of that you override any of the wishes or rights. They're not wishes. They are rights and responsibilities of the heads of our boards, our professional boards. You know, in nursing alone, we have 380,000 nurses in the state of California. That's a lot of voters. They deserve to be represented, not to be sidetracked into some kind of a legislative council opinion because you don't like what they're saying about this committee and these standards. My other concern is that, again, treatment works. I am old enough, some of you may not be old enough, but I am old enough to remember when addiction and alcoholism was a public health issue. Somewhere about 20, 30 years ago, we decided it was a criminal issue. Well, we only need to look at our Department of Corrections to see how fabulously successful that was. As I read these standards, I see more criminalizing and less treatment and rehabilitating. Okay? I really encourage that we look at these standards, that we look at implementing them, that we look at if, in fact, we want to protect the public and not just say that's what we want to do. What we have to look at is designing programs that will get our healthcare providers into treatment early, get them out of practice immediately. The Board of Nursing does that now. As soon as a nurse is reported, her license is placed on inactive and she is not allowed to work, many times for a year. So the model's been designed. We just need to apply it to all of the healthcare boards. Again, I want to thank you for a very difficult job, and I hope that you hear the concerns of the professional community on these issues. Thank you very much.
Thank you. Thank you for your comments. Yes, ma'am.
Although these are very interesting comments, I was actually here to talk about the acupuncture board, if that's all right.
That's all right also.
But I work in integrated medicine, so I feel right at home with my colleagues.
Thank you for your comment. And before, as you're leaving, let me just comment that the document, the report is a public document. We certainly don't intentionally put on anything that's inaccurate or it's untrue. If you have some discrepancies or some differences, certainly please bring them to our attention specifically. I invite you to submit anything in writing that may be helpful as well. We certainly want to encourage uniformity in the execution of the rules and regulations, and I agree with you. That is the ultimate objective, and so anything we can do to make that happen. So
where would we send these comments?
You may send them to the committee, and we've got can we get a card or some information to the for the public. GB, can you give them a card so that you'll have a specific person you can follow up with?
Thank you so much.
About the issues that you raised. Yeah, thank you.
And I think there are a few others. My name is Dr. Elizabeth Goblat, and I am the Director of Assessment Planning at the American College of Traditional Chinese Medicine in San Francisco. I've also been president of one of our colleges and vice president, and have worked both in-state and nationally and internationally on education, not just in our field, but also in what is now being referred to as interprofessional education for all healthcare practitioners, so that they know about each other and how to work with one another. I am here today because I've been observing this particular board since the mid-90s, and I read the staff report, and I would like to say that I believe that it's an excellent report. I would agree with the staff report for a maximum of 2-year renewals, because I personally, as an individual, also have tremendous concerns about this particular board. One element that I would like to correct for the record is that there are 46 states plus the District of Columbia that license or regulate acupuncture. All of them use the national exam, and they use one module in particular, which is called the acupuncture module. But the national exam has developed other modules, which some of the states may use and other states may not use.
Which organization?
This is a national exam, and I'll put it all in writing for you. It's called the National Commission for the National Certification Commission for Acupuncture and Oriental Medicine. And so that national exam is actually recognized in every other state and D.C., except it's not recognized here in California. And they all require at least this one module on acupuncture, but many of the states require some of the other modules, for example, on Chinese herbs. So, again, I will put this in writing. And one of my concerns, having been an observer here at this state board as well as many other state boards, is I do agree with the staff report about the board operating in an efficient and effective manner, and that there are areas that could indeed be greatly improved, and that both board and staff training, I think, especially in what's appropriate for agendas, and then holding to those agendas at meetings, and also keeping the board really, in a sense, within its scope, as well as the comments from the public. We're all aware that the main role of a licensing board is protecting public safety. And at many of these meetings, I have observed and needed to participate in tendencies to try and micromanage a college's curriculums, talk about 100 hours here or 20 hours here, or promote expansion of scope, or be a venue of promoting the profession, which both the previous committee that evaluated this board commented on, as well as the Little Hoover Commission. So I would agree with the staff report that there could be significant improvement in how this particular board and staff operate. When they do move into the issue of protecting public safety, and they spend time in that area, I do find that they're very efficient and very effective. But when they become derailed on trying to micromanage colleges, develop curriculum, and they don't have expertise in education, is when I think many of these issues become quite skewed. So the one element I'd also like to mention, which is mentioned in this staff report and again by the previous committee and by the Little Hoover Commission, is that California now is the only state that does not require accreditation, and by an accreditation commission that is recognized by the United States Department of Education. And that's because licensing boards are not expected to have expertise in education to know how to go out and really review a college. And frequently, accreditation site teams will send 5 or 6 people out. They'll review the college. They have expertise in education, as well as expertise in administration, governance, etc. And with all due respect to this board and the staff members, they simply don't have this level of expertise. So I think that one element, and I know that this is really more of a hearing about this particular recommendation for 2 years, but one thing that I think that ideally would occur in the board training would be to strongly urge this board to work jointly with the Accreditation Commission. I think that would diffuse frequently a lot of the elements that have in this board meeting, which tend to go in, as I say, to, trying to micromanage colleges, tell them what their curriculum should be, promoting primary care practitioner, which is beyond the scope of current scope, and it's not the role of a licensing board, or promoting the profession. So I'll put this on.
All right, thank you.
Writing, but I do think that the staff report was excellent. Thank you very much.
Thank you for your comments and for your compliments. Yeah. Yes, sir.
Thank you. My name is Neil Miller. I'm representing myself today, but my background, I've attended over 80% of the acupuncture board meetings since 1989. I've attended more than anyone, and have participated in the previous Blue Ribbon Panel, Education Committee, Curriculum Competencies, and so on and so forth over the years. And so I just have a few brief comments that might help the committee.
Yes, thank you.
I think that the first recommendation, in relationship to the quorum, I disagree with the staff's recommendation that a licensee not be present at the acupuncture board meetings. It's very difficult to have just one acupuncturist at the board meeting. As a licensed acupuncturist, if you put several of us together, we would have different ways of approaching the situation, and it's, in my opinion, been a hindrance having a smaller board since the reconstitution. So I believe that it has hampered the consumer to give the consumer as broad a base perspective for the board to make its decisions on all of the various nuances of practice throughout the state. When it comes to the scope of practice, I think that in the history of the board, they've looked at scope of practice, and I think that since the last legislative review committee, the emphasis has been more on clarification of scope of practice. There are some, you can discuss primary care and so on and so forth, but I have a specific issue dealing with a term that's used that's out of date. It was called Oriental massage, and then they changed that to Asian massage, and the modern medical term is manual therapy or myofascial release. And we approached the board to do regulatory changes, and they said that needed to be a statute. So they addressed it in the way that you've recommended. And then when we did the statute, it went to the governor, and the governor vetoed it. But it did make that bill did make it to the governor.
Last year, when was it vetoed? When did that bill come up?
Koretz did the bill, so it was in Koretz's last year, and Senator Cedillo, Assemblyman Cedillo, when he was in the Senate, also introduced this similar bill. So I believe that there is a role where scope of practice has to do with education, and education has to match the scope. So I don't think that the board has been, their main emphasis has been on scope, but how scope relates to many of the other oversights that they have. Okay. And I think that it's missing from, and I would hope that maybe you can make that such a recommendation that they review the idea of manual therapy, because I since brought it back to the board, and the board has approved of making a regulatory recommendation to include in the language Asian massage and manual therapy myofascial release. And I have a problem with the board that they haven't followed through. So in agreement with the committee's report, this is one issue that they have taken on, addressed, and then let the ball die. And I've been working on this issue for over 12 years. Where it impacts the consumers, that consumers get a letter from the insurance company that says, we don't pay for the procedure when done by a practitioner of this nature, because the specific scope says Asian massage, and there isn't what they call a CPT or correct procedural terminology for that. That's just an example of where they do have a role in scope or in clarifying in clarifying scope. You had a question?
No, I'm just asking you to summarize if you could.
I'm glad to. In the oversight of schools and with the approval process, I believe that the accreditation department does a very good job. The accreditation committee that is approved by, that goes through the U.S. Department of Education, has a track of being an official accreditation program, and I think that the board should look at that, and I think that it would be effective. But where I disagree is that there is no national exam, and so I disagree with the report that they should look at a national exam. This issue was debated ad nauseum and then sent to the Little Hoover Commission, and they had their findings. So I think that the report is inaccurate, that there isn't a national exam, and they shouldn't go to that, and there's a reason why, because California is very different. The amount of practitioners in the rest of the country add up to, California almost adds up to the amount of the practitioners in the rest of the country. Our scope of practice and our responsibilities and our expectations by the consumer is very different in this state than in other states.
Okay.
So the scope of practice is a movable thing, and I think that addressing the national issues and California issues and separating those is very important, and there's a reason why it's done that way. And I agree that the exam fee should be raised so that they can cover the various costs of the approval process that's necessary for out-of-state schools, as well as adding a fee to the continuing education.
Okay. Thank you. Thank you for your comments. Yes, sir.
Bill Mosca, California State Oriental Medical Association. I just have a few brief comments. First of all, I'd like to commend the staff on what I view as a generally accurate report. There are some areas of nuance that we'll be commenting on in written testimony, and we'll get that to the committee. Just a couple things that I wanted to touch on. One is the accreditation by a U.S. Department of Education recognized accrediting agency. This is something that we support here in California, but as was pointed out earlier, there was a bill sponsored by the Acupuncture Board a number of years ago, 3 or so years ago, that would have done this. The bill failed, and this is something we would welcome working with the board in the future to enact. Regarding specifically the continuing education approvals, that's one area where I have seen what I view as significant progress within the board over the last year or two. We did have some issues with approvals being given to courses that really just I think virtually everyone would agree were questionable. I think that those have largely been addressed. There are always going to be a few course approvals that manage to sneak through, even in the most robust approval scheme. But I think the board is doing a significantly better job today than they were a year or two ago. And my last comment is a more general one. I think, in reading through much of this report, the core issue to me is that frequently meeting agendas are being hijacked by minority voices from within the profession, and undue amounts of time are being dedicated to discussions that are really out of the purview of the board entirely. Those discussions are allowed frequently to go on for far too long. For me, this is largely a function of board development and training, and it's an area that I believe that this board really needs to be directing some energy and resources. Those are my comments. As I said, we'll be submitting some more extensive comments in writing.
Okay, thank you.
Mr. Chair, I couldn't agree more with that. His last comment. I'd like to make one final comment.
Just a brief closing comment.
Very brief. It's in defense of the Acupuncture Board. We've been told over the past several years that the board wasn't able to do certain things because of budgetary constraints. And I'd like to point out to the committee that I'm sure you're aware that our board is the money generated is from licensing fees. And so giving them furlough Fridays has hampered the consumer in that 20% of the regulatory oversight of the board has been taken away from them. And I think if the board was given a full work week and the teeth of the department behind them to do their enforcement and to have the meetings, then they would be doing a much more efficient job. Thank you again for
All right, thank you for your comments. Any other public comments on the Department of Consumer Affairs or the Acupuncture Board? Any more comments, observations? This is still a fact-finding process. We're not taking any votes today. We're gathering information for a final recommendation to the committee at a vote, and so your comments are timely. And if you're not submitting any testimony today or testifying today, you still have a little time to do that, and so we would encourage you to do so. Did you want to make a comment? Yes.
Good morning. Thank you. Cindy Young, California Nurses Association. I just wanted to raise our concerns around having the standardized standards for the diversion program. We really believe that each profession has a different set of issues and standards that the Board of Registered Nursing has really kicked up its efforts in terms of the diversion program and beefing up its efforts to get enforcement going, and that we think that, each board should have its own standards.
Okay. Thank you.
Thank you.
Okay, no other comments. We're going to move forward to our next panel, review of the Board of Podiatric Medicine. I'll invite Neil Manzorf, the board president, up, Ms. Dixon, Legislative Committee, Karen Rubel, immediate past president, and Jim Rathlinsberger, executive director. Easy for me to say, I know. Executive Office. Welcome.
Good morning.
Good morning.
Thank you, Chairman Price, and to the committee for allowing us to be here today. In fact, we appreciate you allowing us to be seen this year. I'm Dr. Neil Mansdorf, current president of the Board of Podiatric Medicine, and accompanying me today are fellow board members, as you introduced, Ms. Christina Dixon, our legislative chair, and our immediate past president, Dr. Karen Rubel, and executive director, Mr. Jim Rathlinsberger. A brief overview of the Board of Podiatric Medicine. The Board of Podiatric Medicine is a small board regulating approximately 2,000 doctors of podiatric medicine. Podiatric physicians are licensed under the Medical Practice Act to provide medical and surgical services of the foot, ankle, and the soft tissue structures affecting them. The Board of Podiatric Medicine has a budget of just over $1 million and a staff of 5 people. We are a part of the medical board and utilize its staff for many services under a shared services agreement, especially for enforcement. I would like to commend the committee staff on preparing an excellent background paper on us, and also for their openness and dialogue along with our board in preparing for this hearing. We concur with their recommendations, and the committee has asked us to comment on a couple of points, and with the committee's permission and the assistance of my colleagues, I'd like to briefly touch on each of these points.
Okay.
First item was single license scope. The Board of Podiatric Medicine concurs with your staff recommendation to consider amending Business and Professions Code Section 2472 to strike the reference to January 1st, 1984. After 30 years, this will reestablish a single scope of practice for all doctors of podiatric medicine. The useful life of the 1984 two-tier licensing system has run its course. More than 80% of the Board of Podiatric Medicine's licensees are, quote, ACLE licensed, and this percentage will continue to increase with time and age. Single scope licensure will simplify our statute and eliminate confusion without harm to the public. Second item on the agenda was the BRIE status, which will be discussed by Ms. Christina Dixon.
Good morning, Chairman Price and staff. I'm here to just give you a brief update on our BRIE status. The Board of Podiatric Medicine has met multiple times with the BRIE's team and provided all the data that has been requested. There have been several configuration sessions that have been scheduled. The first one will be March 19th for the licensing portion, and then the second on April 2nd for the enforcement portion. Implementation is scheduled for the board for either summer of 2012 or fall of 2013. The cost to BPM is approximately $50,000 through fiscal years 2012 and 2017. This is a $38,000 increase over the $12,000 previously budgeted for iLicensing. And beginning in fiscal year 2018, the annual maintenance cost will be around $1,000. And we're moving from an antiquated system to a state-of-the-art system, as DCA indicated. And now I'll pass it on to Dr. Rubel.
Good morning, Chairman and the rest of staff. I'm board member Dr. Karen Rubel. As I was already introduced, immediate past president. I served as president in 2010 and 2011 during the preparation of this sunset report. I'm going to address the credit card convenience fees that will come with the BREEZE system. The department plans to assess the Board of Podiatric Medicine $15,000 a year beginning July 1st for those credit card convenience fees for online license renewals. And that number was arrived at by 2% of our $900 renewal fee, the highest in the department. So while the convenience fee would be $2.80 for the RN, it would be $18 for a DPM because of the difference in the renewal fee, obviously. So the DCA projects 833 online renewals per year for our board to arrive at the $15,000 number. And we have just felt that it would be extremely difficult to absorb or justify that level of fee for just 833 renewals. And so we have voted, regrettably, but in order to keep our operations in the black, to pass that convenience fee along to the licensee who chooses to renew online. We just feel that that's going to be necessary. And so we voted in September last year at our board meeting to do that. And we have consulted with the DCA legal office, and who has confirmed that we have no additional statutory authority necessary in order to.
You don't. I'm sorry, that you don't require any authority.
Require any additional
in order to impose the fees. You
Correct.
do not need the authority. Okay.
Yes. So those are my comments. Thank you.
Okay.
I have no prepared comments, but we're prepared to answer any further questions that you may have. Thank you very much.
Okay. Do you think the fee for services, other than for license renewals, should be increased? Anything else, or just license renewals?
The proposal in our sunset report is not to increase the renewal fee, which is $900 every 2 years, which is the highest in the department. We have proposed, I think even on our last sunset review, to increase our various fees for services, as indicated in our report. Now, that was a recommendation that the department's budget office made to us in very strong terms when the $900 renewal fee was initially made a temporary measure, and then eventually, with this committee's support, made permanent. Looking at our fund condition, we're in a situation where we have the highest fee in the department, but one of the smallest budgets. So we have to watch our fund condition very carefully. Our revenues, which are 90% of our revenues, come from the renewal fee, and our revenues have not matched our budget since fiscal year 2007. Now, the department's projection of our fund condition shows us in the black through fiscal year 2013, the current budget year before you for consideration. Our own fund condition analysis, which includes our projections of maintaining a very tight ship and keeping costs down, show us in the black through fiscal year 2015. And that's been the case for some years, and we keep extending the life of our fund by staying under budget every year and returning money to our fund, so that money is there. But with increasing costs, that can't be. That's something that we probably we can sustain for only a short period of time. So we're not proposing an increase in the renewal fee right now, but those fees for service are something that we think is a good housekeeping step. It's not the long-term solution to the problem. It would only increase our revenue $11,000 a year, but every measure like that does help.
Mm-hmm. And the general response from the membership has been, do what you got to do. We don't care how much it costs, or.
We've highlighted this in the association's magazine, which goes to all of its members, and asked if for any feedback, and I have received none. My sense is that our licensees paying a renewal fee of $900. We addressed this in a meeting of the association last week. And I commented that if we passed this fee on, the renewal fee would be $918 rather than $900. That didn't seem to stir any opposition. Our licensees with the highest renewal fee of $900, I think many of them would like the opportunity to renew online with a credit card. Now, some I'm sure will choose to continue sending in a check, and saving the $18. But for us, as Dr. Rubel indicated, $15,000 a year for 833 renewals, that's not something that we can justify or support or absorb into our fund condition. It's just not there.
Okay. You have a comment?
No, I agree with that.
Switching reels a minute. Currently, the board is under the jurisdiction of the medical board, and is that relationship seem to be an amicable one?
Yes, I would say so. That's a relationship that has, it's long-standing because I think initially it was called the Podiatry Examining Committee was created by this committee, and I believe that was probably sometime in the 1970s. Prior to that time, DPMs were just licensed by the medical board as it licenses MDs. So we've always been licensees of the medical board, and since our organization was carved out as an entity within the medical board, we're part of the medical board. That relationship has evolved. In years past, there are some issues. Right now, there really are none that I can think of. We're not. I don't think we're not recommending a change in that relationship in that organization.
And I don't think they are either. So it's good. Well, I want to thank you for your testimony. The board and its members and members of the profession seem to be very diligent in trying to make sure that the board is certainly reflective not only of the professional concerns but also consumer concerns. And that's the dual challenge that we have. And I just appreciate your testimony today and your ongoing efforts to make the profession something that will represent the interests of the state of California in a proper manner and certainly represent the best of your profession. So keep up the good work.
Thank you.
Thank you very much. Are there any comments, public comments, on the Board of Podiatric Medicine? Any public comments? Observations? Okay, seeing none, we'll move on to our final review for the morning, and that is of the Court Reporters Board. Court Reporters Board. Good afternoon. I see we have Gregory Finch, the board vice chair.
Yes.
And Yvonne Finner, executive officer.
Yes.
And
Paula Vernon, executive analyst.
Okay, welcome.
My name is Yvonne Fenner. I'm the executive officer for the Court Reporters Board, and I have with me today our vice chair and former chairman, Gregory Finch. He's a litigation attorney from the local Sacramento area, and he's serving as a public member of the board. He's going to begin our presentation with a brief overview of the board.
And thank you. Good morning, Chairman Price and committee members and staff. Thank you for the opportunity to update you on the board's issues and activities since our last oversight hearing. Originally established as a certified shorthand reporters board in 1951, we are now known under the more familiar term Court Reporters Board, although licensees are still often referred to within the legal profession as CSRs. The board licenses court reporters who work either as official reporters hired by the courts to work in courtrooms or freelance reporters hired by attorneys to report depositions. There are currently approximately 7,300 licensees. The board does not license the fastest growing segment of the reporting industry, which is captioning. Captioning, yes, thank you. Because court reporters are able to produce instantaneous written transcripts of oral proceedings, their services are utilized by not only broadcast captioners who create the English subtitles on your television screen, but also academic settings to aid the hearing impaired student in the classroom. Court reporters are highly trained professionals who provide verbatim transcripts of judicial proceedings, creating a record which forms the foundation of all appeal rights. Having timely access to the accurate transcripts of proceedings is a key component to our judicial system. Courts of appeal rely on the transcripts to determine lawfulness of what happened during a trial. In a criminal proceeding, the stakes are high, imprisonment, even life or death. In civil proceeding, the stakes may include millions of dollars in complex business litigations. The board's mission is to ensure the integrity of the judicial records through oversight of the court reporting profession. It does so by testing, licensing, and disciplining court reporters and by ensuring court reporter schools meet certain curriculum standards. Additionally, the board is responsible for the administration of the Transcript Reimbursement Fund established in 1981 to ensure qualified indigent litigants for transcripts in civil cases. The CRB maintains two funds, one for the board's revenue and expenses and a separate fund for the Transcript Reimbursement Fund. Funds are transferred from CRB to TRF up to $300,000 per year. The current budget for the CRB before transfer to the TRF is just under $775,000. License renewals are the CRB's largest source of revenue, comprising approximately 91% of the operating fund. Another 3% comes from examination and license application fees, and just under 3% is comprised of payments of citation and fines. Miscellaneous revenue, including delinquent fees and investment income, accounts for the remaining just under 3%. The CRB receives no federal fundings and no revenue from the state's general fund. The board is comprised of 5 members, 2 are working licensees appointed by the governor. The other 3 are public members, 1 appointed by the governor, 1 by the Speaker of the Assembly, and 1 by the Senate Rules Committee. There are currently no vacancies, although the Speaker's appointee is currently serving out her grace period, and my grace period will begin in June of this year. A number of legislative and regulatory changes have taken place since the board was last reviewed by the Joint Committee on Boards, Commissions, and Consumer Protection in 2005. Mandatory continuing education has continued to be a key issue for the CRB. In 2008, the board sponsored a mandatory continuing education bill, AB 2189, which was ultimately unsuccessful in passage. After the administrative changes of the courts began requiring mandatory continuing education for its employees, including court reporters, the board revisited the continuing education issue. In 2011, SB 61, a similar mandatory continuing education bill was introduced. As in the prior instance, the proposed legislation made it to the governor's desk but was ultimately unsigned. In 2010, via AB 1461, the board sought legislative clarification to Section 8046 of the Business and Professions Code as it relates to firms providing court reporting services. The bill was unsuccessful in passage. Since the board has issued since then, the board has issued a citation and a fine against a non-CSR-owned court reporting firm for violation of gift-giving regulations. As the firm asserts the lack of jurisdiction on the board's part, a request for declaratory relief has been filed in Santa Clara County seeking judicial clarification. The evidentiary portion of the trial took place last week, with closing arguments set for March 16th, after which the court will have 90 days to issue a decision. Also in 2010, SB 1181 authorized a 2-year pilot project expanding the transcription reimbursement fund to pro se litigants who are indigent. Historically, the TRF has been underutilized by indigent litigants represented by pro bono attorneys or qualified nonprofit entities. So this pilot project was implemented in order to maximize the benefits of the TRF, expanding access to justice to those most in need. Additionally, there have been 3 major regulatory changes that affect the board. First, in 2007, the Professional Standards of Practice took effect. The change was a direct result of the April 12, 2005 final recommendations of the Joint Committee on Boards, Commissions, and Consumer Protection. Second, effective September 30, 2001, Section 2411 and 2414 of the California Code of Regulations were amended to update the regulations governing court reporting school curriculum. Because of the growth of the technological advancement in the industry, a task force was convened in 2009 to conduct a comprehensive review of the school curriculum, a key component of the board's 2009-2011 strategic plan. While some of the changes reflect a changing emphasis on need in the field of court reporting or updating terms to more accurately reflect current terminology, the most substantial change paves the way for dedicated online court reporting schools to meet regulatory requirements established by the board, expanding the role of distant learning for court reporting programs. The board's oversight of schools is key as the curriculum is intense in order to prepare students for a license exam and demands a practice in the field. What was once regarded as a clerical position has evolved into a highly technological industry. Third, effective November 9, 2011, the regulations governing examination fees were restructured in a manner that will allow the board to keep more accurate statistics. Another recommendation made by the Joint Committee advised the CRB to change the statute to make it explicit that the CRB should disclose letters of reprimand. In response, the CRB now publishes all action taken on CRB's website and also in the biannual newsletter. It should be noted, however, that the mere fact that a complaint has been received is kept confidential pending the outcome of the investigation. Yvonne will address some of the issues that were raised in the report.
I'm going to take them a little bit out of order, starting with issue number 3, the non-CSR-owned firms violating the laws that apply to court reporting, and then asserting lack of jurisdiction on the part of the CRB to act as far as enforcement. In response to a growing number of complaints about unethical gift-giving and violations of the minimum transcript format standards, the board established a task force in 2007 to study the issue of firm oversight. The members of the task force included firms of all sizes, and ultimately the task force arrived at the language which was included in AB 1461. It was the intent of the board to seek statutory clarification to Business and Professions Code Section 8046 as it relates to firms providing court reporting services. AB 1461 sought to clarify that all firms that provided court reporting services, regardless of how the entity was structured as a business, were required to be held to the same standards as shorthand corporations or individual licensees. The legislation, however, was unsuccessful in passage. In 2010, the board issued a citation and fine against a non-CSR-owned court reporting corporation for violation of the gift-giving regulations as set out in the Professional Standards of Practice. The corporation refused to pay the fine, asserting lack of jurisdiction by the board. So the board filed an action for declaratory relief in Santa Clara County, seeking judicial clarification of the statutes. And as Vice Chair Finch noted, the trial took place last week, and we are eagerly awaiting the results of the court's decision. It's counterintuitive to have the activities of corporately owned or non-CSR-owned businesses offering court reporting services to be outside the jurisdiction of the board. The ultimate consumer of the transcript is the litigant, who is often quite removed from the transactions between the attorney and the court reporter. If an attorney hires a firm because of a large gift, a direct violation of 2475 sub A8, rather than competitive rates or quality of service, the consumer is unknowingly the victim. Similarly, if there is a violation of 2473, the minimum transcript format standards, the consumer could end up paying hundreds or even thousands of dollars more for transcripts. This consumer is all the more vulnerable for not being educated in the legal standards to which he's entitled. The court reporting industry is a multi-million-dollar industry in California, and we welcome business. However, all entities providing services should be held to the same standards. The CRB agrees with the committee staff recommendation that Business and Professions Code Section 8046 be amended to clarify that any entity offering or providing shorthand reporting services must comply with the laws governing licensees of the board. If there are no questions on that section, I'll move on to the next issue.
Move on.
The decreasing fund reserves, that's issue number 6. As previously noted, most of our revenue comes in from license renewal. Since we have a relatively stable number of licensees, our revenue stays relatively stable. The board currently has a very healthy fund condition with 19.3 months in reserve for the current fiscal year. That being said, the committee has noted a decline when projected into the future, with the negative hitting in fiscal year 2018-19. We have had some high expenditure years. For example, the year that we did the occupational analysis, that's conducted about once every 5 years. That's necessary to make a legally defensible exam. That's an extensive, detailed study of current practice in the field, and that data is used to develop the examination plan, which allows for the formation of the license exams to make sure it's current and relevant. So an analysis of the numbers reveals that the decline in the fund reserves is a result of the ongoing funding of the TRF. In the early years, the TRF was funded in smaller amounts, basically as the applications warranted. A few years ago, the TRF began to be funded automatically at the beginning of the year with a full $300,000, regardless of the amount of the applications. So because the TRF has been fully funded for a majority of the years of its existence without being fully utilized, the reserves in the TRF are such that the CRB could reduce or temporarily suspend the transfer of funds into the TRF. This would help the CRB's reserve to stay positive for the foreseeable future while still reimbursing all eligible applicants to the TRF. And if there are no questions there, I'll spin into the issue number 4, which is the underfunding of the TRF Pro Per pilot project, or possible underfunding, I should say. As noted in the overview, there was the enactment of SB 1181, which authorized that 2-year pilot project that started January 1st of 2011. That expanded the use of the TRF to pro per litigants. So on a very limited basis, $30,000 of the main TRF fund was set aside for use for people that represented themselves, with a case cap of $1,500 per case. The intent is to utilize the maximum number of TRF. The funds are there. They might as well be available to be used to the maximum number of people. And from the perspective of maximum utilization of assistance funds, the ProPer pilot project has been a success. To date, over 100 litigants have been assisted by the ProPer pilot project, many of whom may not have been able to pursue their cases or appeals without the assistance of the TRF. The large volume of applications attests to the demand for the project. The entire $30,000 allotment for 2011 was allocated after processing an application received July 15th, 2011. So just 7 months into the program, it was fully allotted. Staff reviewed 22 of the applications. Letters were sent to 17 informing them that their funds would be allowed, and 5 received letters of incomplete or rejected applications. Staff continued to accept and process applications as previously allotted money became available. In most cases, allocations are based on estimates provided by the applicants from the court reporters. As the invoices come in and are processed, the actual cost for the transcripts came in commonly lower than the original estimate. Therefore, previously allocated money slowly became available and was redistributed to other applicants. As of January 1st of this year, an additional $30,000 became available, and staff began processing the 73 applications remaining from 2011. Several invoices for cases provisionally approved in 2011 were received and processed after the end of 2011. Therefore, there was about a $925 surplus, which has been applied to the available funding for 2012. We basically just rolled it over. There are still 45 outstanding invoices from estimates provisionally approved in 2011, totaling just over $10,000. Concern has been raised by licensees and court clerks regarding the fee waiver that's required as proof that the applicant is indigent. According to these parties, the applications for fee waivers are not verified by the court, and many of the applicants we have approved do not qualify in their opinion. The board finds this troublesome, but is at a loss for adequate replacement for verification of each applicant's financial status. Current limited staffing resources does not allow for staff to review or validate such information. An additional factor in consideration of the pilot project is the increasing move toward privatization of the courts in California. Several counties have decided not to provide court reporters in civil matters, requiring litigants to supply their own court reporter. This additional cost to the litigant may bring increased demand for assistance with costs associated with obtaining a transcript, which may in turn consume the overall fund more quickly. There could be staffing issues if the pilot project were to become permanent or if the $30,000 cap were to be increased. While existing staff was able initially to absorb the workload, the TRF workload increased by 70% in 2011 compared to prior years. This resulted in the inability of staff to perform mandatory oversight of recognized court reporting programs or to reach significant strategic plan objectives. In addition, B&P Code Section 8030.6 sub F indicates that actions shall be completed within 30 days of receipt of the invoice and TRF application. However, the processing time increased to as much as 60 days during some of the periods for the main fund applications, just due to the increase in the TRF applications overall. The board is supportive of every effort to maximize the use of the TRF. In light of the increased workload, however, and the pressure that decreasing appropriations in recent years has placed upon staff resources, the board does not feel that the project can be sustained with existing staff. The board would happily redirect resources, but for the fact that they have, over the past 3 years, cut all but mission-critical activities. With no action from the legislature, the ProPer pilot project will sunset at the end of 2012. If it is the pleasure of the legislature to extend or expand the pilot project, the board hopes that the decision makers are mindful of the concerns that I've shared with you, but we await your direction. We have technical staff here. Paula actually administers the TRF, so if you have any technical questions, we can answer those. And if not, issue number 7 was a technical correction that committee staff correctly pointed out to us, correcting the current iteration of Bureau for Private Post-Secondary Education. That matter will be placed on the board's next agenda, which is April 27th, 2012.
In conclusion, we assure the committee that the CRB remains committed to protecting the consumers of the state of California. We operate such that each day is worthy of oversight, and we welcome feedback and recommendations from the committee. We support the conclusions and recommendations reached by the committee staff, and thank you very much for your time.
Well, again, thank you for your testimony and for your support of the board's the staff's recommendations. That's very encouraging. Let me ask you, why do you think we haven't had any success with this continuing education component? I had a bill, as you know, last year. You referenced the bill earlier. Any hint from the administration on what they'd like to see, or obviously they don't want to see the continuing education as it's been proposed,
from my point of view, I think there's not a full understanding of the significance of the court reporter, and they are more than clerks. What they do, they're guardians of the record, and I don't think that's fully recognized. And I also think it's a small group, so it doesn't get a lot of attention. So I think that's part of it. The associations of the court reporter, different ones, all want the continuing education, and there are things that that court reporters do not necessarily follow and are not fully aware of, and I think it's a real education issue.
The board has been looking at it from a different angle in response to information from the administration, possibly looking at continuing competency rather than continuing education, just to make sure that we are not putting artificial burdens on the licensees, that they're actually trying to maintain competency for the interest of the consumer.
Mm-hmm. Especially with technology and other ways of delivering the service in a more efficient, more accurate way in this digital world, I think continuing education makes sense. So, and especially when you have the professional organizations in support of it, it's kind of quizzical why the administration won't. But,
and the courts have mandated for their reporters. So.
They have?
Yeah, they did that 4 years ago.
Federal courts, or which courts?
The state courts.
Well, state courts.
The Administrative Office of the Courts has mandated continuing education for all of the court employees, including court reporters. Mm-hmm. So that's why, through your bill, we tried to do expanding it to the freelancers, and so it was just straight across the board. Everybody had it.
Same. Well, again, thank you for your service, for your commitment to the profession, and for your professionalism, and making certain that these services are provided to the public in a way that protects their interests and helps us to maintain the important tenets of justice in our society. So keep up the good work. Thank you.
Thank you.
Thank you for your time.
Are there any questions or comments on the court reporting board? Please come forward.
Okay. Good afternoon. My name is Pam Katros. I'm an official court reporter in Placer County, and I'm here representing the California Court Reporters Association. CCRA supports the continued operation of the Court Reporters Board in regulating court reporting profession with testing and licensing, school accreditation, and disciplining of the court reporters. The CRB, as you heard, is self-funded by the court reporting licensing fees and other fees that they charge. Unlike any other licensee in California, the shorthand reporters donate to the Transcript Reimbursement Fund, which helps indigent litigants in purchasing transcripts. And the Court Reporters Board oversees this desperately needed process. As you know, the TRF was originally conceived and implemented under Governor Brown's previous term. We support the Court Reporters Board's involvement in litigation against the non-CSR-owned court reporting firm U.S. Legal over unethical gift-giving, which has been long overdue. And CCRA also supports the recommendation to clarify Business and Professions Code Section 8046 to provide that any entity offering shorthand services must comply with the laws governing licensees. The CRB is a very active board. They, like CCRA, support continuing education for all reporters. And CCRA would like to thank you, Senator Price, for sponsoring that bill. We appreciate it. CRB members are also, they attend our seminars and conventions. I believe they attend all the association's seminars and conventions in supporting education for its licensees. So in summary, I urge you to retain the Court Reporters Board. I believe it is a vital and essential board to the consumer. Thank you.
Thank you. Thank you for your comments.
Hello. Chairman Price, Vice Chairman Emerson. I'm Antonia Pallone, representing the Deposition Reporters Association of California. And I'm a licensee myself in San Jose and an agency owner there. And briefly, on behalf of my association, I'd just like to thank this committee and its staff for the work you've done on this issue. We, like CCRA, enthusiastically support the continued existence of the Court Reporters Board. And we particularly would like to support your recommendations and the board's recommendations on the issues of continued looking into the continuing education requirements for all court reporters, all licensed court reporters, and your recommendation that they continue to work with the administration towards accomplishing that goal at some time. We hope that comes to fruition. And again, we appreciate your work, Senator Price, on sponsoring the last bill on the mandatory continuing education for all court reporters. Likewise, we'd like to support the board's recommendation that all corporations, court reporting entities of all types, be required to follow California law regarding court reporting. It, as your report says, your background paper says, it's certainly counterintuitive that any entity that offers court reporting services to the consumers of California would not be required to follow California law that applies to our profession and would not fall under the auspices of and oversight of the Court Reporters Board. And we also recommend that, or support your recommendation, that BNP 8046 be amended so that that language becomes clear that all entities providing court reporting services must abide by California law. We hope that also comes to pass very soon. So thank you very much for the work of your committee and your staff on these issues.
Thank you. Thank you for your comments. And I wanted any other comments? Any other comments on any of the testimony we've heard today from any of the boards? I want to thank everyone for your attendance and for your commitment for helping to make sure the Department of Consumer Affairs is able to operate smoothly and effectively in its various sections. I appreciate the testimony from the administration and also from the industries that have been represented. Thank staff for your excellent work in laying out the case. And if there's no further business, this meeting will be adjourned.